Hi, Dr. Z from Universal Chiropractic. One of the most common questions I get at the office is, what's the difference between traction or an inversion table, or our DRX 9000 and our Chattanooga table and our Kennedy decompression table? So there's a lot of different options that can be done to help with a herniated or bulging disc. So to explain it in a little bit more detail, I'm just going to kind of break down some basic concepts here for you. So when we look at the spine, what we're trying to do is take the vertebrae and open them up in a way that's going to allow disc material to reabsorb. So when we talk about an inversion table or spinal traction, essentially what happens is, if you've ever seen those tables where people will be standing upright and then they go completely upside down or at different angles, your body goes from point A to point B instantaneously. And we call this a straight pull. So here's point A, and you get an immediate traction, and it holds it there, and then when you're done, it releases it. The problem with that is you're going to get over contraction or overstimulation of your muscles, and it doesn't maximize the amount of disc material that can be resolved or reabsorbed with a decompression session. So inversion tables aren't bad. You know, we tell patients all the time, hey, if you have a back injury and you're doing spinal decompression, you want to get an inversion table and do that in between your sessions. It's great, but it's not really going to maximize disc material reabsorbing. And that's what separates the decompression tables from the inversion table, is what we just talked about, reabsorbing disc material. And the decompression tables, and we're talking about the DRX 9000, the Chattanooga tables, or Kennedy tables, or there's other decompression tables out there. Their computers are set up in a way that are going to have two different pull system, or two different pull patterns. We talked about with the inversion table going from point A right to point B, and then when you're done, releasing it, causing, unfortunately, an overstimulation of the muscles. The two cycle patterns that the other tables that we talked about are a static pull and just regular cycles. The static pull is a gradual stretch from point A up to point B, and it takes a couple minutes to get there, and then it'll slowly release it. And that, if you can just envision this going in slow motion, separating that joint space, holding it, and releasing it over the course of 12 minutes. And that's what a static pull is. Then we talk about cycles, and this really drives home that disc material reabsorbing. And that's a combination of a traction, hold, release, traction, hold, and release mechanism. So if you think about it, going back to the model of the spine, we have a traction, release, traction, release, and roughly you get about maybe a dozen of those over the course of a minute. So it's still very slow and controlled. So that tells us the difference between an inversion table or traction versus decompression, when we talk about the different cycles. Now, when we start to talk about the different tables and what they do, well, what makes this Chattanooga table different than the Kennedy table versus the DRX 9000? When we go over to the Chattanooga table, model the spine down here, basically we have a pulley system. We set up into the computer how much poundage we want to apply for that particular session, and how we want that program to be set. Do we want a constant pull with the release, or do we want cycles? And there's a nice controlled computerized motion that does this. We have a lot of success with this. And over here we have our DRX 9000. You can see it's a little bit more fancier. Definitely more computer generated than the Chattanooga or even the Kennedy table. And when you're on this table, we're still setting it up to do the same mechanisms of traction, either static pull or cycles. But this table constantly is monitoring, measuring, and correcting forces that may be taking place while you're laying on a table. So maybe you're tightening up, or your back is over, contracting, or you just might be uncomfortable. This is constantly adapting to how your body is responding to the decompression. So of course it's a little bit more advanced. But at the end of the day, I've been applying decompression for patients with bulging and herniated discs, and have a lot of success with the Kennedy, Chattanooga tables, and of course the DRX 9000. They're both great. All three of them are great forms of therapy. It all depends on what you can afford and what your budget allows you to apply for. But at the end of the day, if you're doing some form of decompression in accomplishing a static pull or cycles versus a straight pull, you're going to have much more success in reabsorbing that bulging or herniated disc.